Hello, everyone. I am Iqbal Alamri. I am a medical physicist working at Sultan Qaboos Comprehensive Cancer Center. And today I'm going to talk about how to start an LDR program. I'm just going to share with you our experience here in the center. And yes, Dr. Nadeem, I would like to live in Oman, and those pictures are from my country, Oman. And thank you for all the nice words you've talked about. So since morning, and whoever was with us in the morning, you have seen or you have came across all the clinical aspect, the physics aspects of LDR program or LDR technique. Now, there is one important thing also you want to talk about or you want to learn about, which is the admin part, or what do you need to do in order to start any technique or to start an LDR program. So I'm gonna first give you a statistics about the radiotherapy in the region. Here, particularly radiotherapy centers in our region. We have this is the data based on DIRAC, which is the Directory from Radiation and Oncology, IAEA. We have around 786 megavolt machine and 117 HDR machines or services, but we don't have any LDR, and except for Oman, now we are the first one in the Middle East. So this is one good chance for whoever wants to start LDR program in your institute. If you want to start, first thing you want to think about is to get a financial support or budgeting. And you have to think on a way how to get approval from your admin. You have to convince them. You have to justify, you can justify the number of patients you are going to treat on a yearly basis, or whoever patient they're waiting for such a service. You have to explain the benefit of LDR among other modalities and overall outcome. You can also talk about the patient's quality of life. And once you get that, you can start the next thing, which is also a physicist can be part of it, mainly physicists and radiation oncologists, which is the tendering. You have to note down, write down all the specifications of your equipment, the ultrasound, the stepper, the software you're going to use, and the radioactive seeds, what type of radioactive seeds you want to use. And also, you have to look for a supplier for the machine and seeds. In my country here, we cannot direct order any equipment from the supplier from the manufacturer. It has to go through an agent or a third party. So you have to look in your country also, what is the status? If you can apply directly, or you can talk to them, it will be even easier and even less prices than going through a third party. So generally, the equipment which you need, which already covered this morning by Dr. Pervez and Dr. Nirmal, operating room for sure, because patient will be going through anesthesia, and VariSeed software, the software which you're going to use for the treatment planning, PK ultrasound with a transrectal probe, CIFCO stepper and table mount. That's what we've used. Make sure the ultrasound you're going to request it can be connected with the stepper you're going to use. And all systems should talk together, because this is all from different companies. The penile clamp and other things which usually the doctors and nurses are taking care of, that can also, you can ask the hospital to provide it. That is available in every hospital. So once you get an idea about all the equipment you want to use in this technique, the next thing you want to do is get the regulatory requirements or approvals from your country. There is so many things you want to get. You get a licensing or you want to get permission. The regulatory requirement, you have regulatory body for sure in your country. You have to go through all the process, the permission, especially if it's the first time you are doing this technique. Maybe this is the first time you're requesting such types of radioactive seeds. And we are requesting that from abroad. We don't have it here in the country. And I think our people here in the region are in the same boat. So get the approval from those people and get the licensing you need. Then the second thing, oh, this is another thing. This is picture for Dr. Nadim and I. I'll tell you the story of this picture later, but just remember this picture. Since we are requesting these radioactive seeds from abroad, you want to get the process of also the custom clearance in your country and set an approximate date once you get those seeds, maybe 2 weeks. You have to keep in your mind if there is anything happen, you might not get the seeds on time. So once the day of the implant, and you have to request that at least 2 weeks before, in case something happened, in case if maybe there is a storm in the US or in Europe or wherever from where you're requesting. So just keep a time between your implant and the time before you request the seeds. Also, you have to know all the challenges that you're going to know. Since it's a new process, you have to know the challenges of the delivery. So you may want to request a dummy seed at the beginning to go through all the process and see where are you stucking or where is the problem, and then you can fix it. So after you are collaborating with the manufacturer, you have to think or to know what type of transport you requested. And in our case, we request the seeds from US, so it's the airline. You have to know which airline you're going to, the airline which is going to ship your seeds, and also communicate with them. So now we get the approval from our regulatory body, which is in my country is Ministry of Environment. And we get the approval from Aviation Authority, in which those Aviation Authority, they give us the permission for the airline which are delivering the seeds. See, I will tell you one thing, doctors. Get a relation or get contacts from all these people and communicate with them and explain for them. Because especially if it's a new technique, they might not know what type of service you are providing, and they might not know the importance of this. And you don't want to stuck in which you have the patient around you and you don't have the seats. So it's better you have to go and explain for them in advance. That's why we, in our scenario here, in our case, one time Dr. Nadim and I went to the Aviation Authority and had a meeting with them, and we explained them the whole thing, and they were really cooperative. Now, whenever we have any patient, they would get the approval immediately. The most important part, once you get all the approvals and the license, the personal training. For sure, you may have to make sure that you have qualified and expert people in your department. They are aware of this technique. And in addition to that, you might request an extra training from the tender you requested in the first time. Once you request the equipment, the software, you can request from the supplier an extra training. In addition to that, you can ask your colleagues, whoever doing this technique, you can ask them to help for training, extra training. You can bring people to come to your center to train you, or you can do virtual training, which in our scenario, that's what we did. We have a lady from cross cancer physicist, Gita, who helped us in doing the planning, and we spent with her a few sessions. And then we went abroad also for training. And in addition to that, a supplier came to us and they show us how to use the system, the ultrasound, the stepper, the software, the whole system. And then once we are ready, we started. The most important thing for a physicist and other team, which the quality assurance, and that was covered by Dr. Nanmal in his talk, you have to go through an intensive quality assurance. And as I said, you have to check all your equipment. They are connecting to each other, and the precise of delivering the seeds, the precise of taking the ultrasound image, make sure everything is good. Then you can also proceed with your program. I have noted down here few safety instructions from our experience, and you might want to also follow these. And if you have anything to add based on your institute, you can do that as well. So in our scenario here, we have a dedicated storeroom for our radioactive seeds. And once we receive the seeds, we document everything, and we keep the documents from the manufacturer. First of all, once you receive the kit, check the physical condition of the kit. There is no damage, nothing broken, just from outside the box. And also label the seeds properly, because you might get more than one kit at the same time. Maybe the doctor wants to treat 2 patients in the same week. Maybe they requested extra seeds, which is in our scenario all the time. Dr. Nadim will requested extra seeds, he might need it. So, and beside that, we are requesting seeds for calibration and for our physics QA. So you have to separate those. Don't mix up things. Label it correctly. Here we have this. We put in different drawers, and we label it correctly, the types of seeds and when we receive it, the activity, and everything. And you can also create an inventory and check that regularly. Maybe you want to check every month, make sure everything is okay, nothing is missing. Also here, we kept this storeroom and we lock it with a key, and the key, only 3 people in the department know where is it. And it's kept in 2 different, the key is kept in a drawer, which in another key is saved in another place. So only 3 people know it. So this is for extra safety. And also make sure that you have a policy and safety in case of any incidents happen or accidents. Maybe if something missing or dropped. And also you have to have a policy how to dispose the remaining seeds. Here in our hospital, we wait for 10 half-lives before disposing the extra seeds. And extra instructions, you during the process or during the day of implant, get a printout of the plan report and cross-check while inserting the needles. We get a printout of the plan, and one of the staff, he or she would read the number of needles and the retraction to the doctors to cross-check. And the other doctor will give they'll take the needle based on the person who is telling the number of the needle. So 3 people are checking, mainly physicists, therapists, and radiation oncologists. They're checking to each other. And after you're done with your insertion, just survey the patient, survey the room, the needles, and make sure nothing is dropped or lost. And the maximum dose for the patient's surface is should be less than 5 millisieverts per hour at 1 meter, less than 5 millisieverts per hour after the insertion. You can also count the number of needles inserted and the number of needles left. Scan the patient to count the number of seeds. After that, what we do here, we scan the patient and count the number of seeds. We compare it with the plan, with the planning. And during the process, make sure that everyone is wearing TLD. And for the doctors who are inserting the needles, better that they wear a ring TLD. Before starting also the whole program, safety instruction should be delivered to the staff and the patient by your radiation safety officer or by your medical physicist. Another thing what we did here, and in my opinion, this thing should be done for every technique that you want to start, end-to-end test. First, set a meeting with the whole team, whoever going to be involved in this technique, radiation oncologist, medical physicist, therapist, and nurses. Establish a protocol or workflow, and then run the same process, but with a phantom. And you can see from the end-to-end test where you are failing, and again, you can fix it. Prepare also the patient education document and instructions, and also very important thing is the patient card. Those patients, we're going to insert them with the radioactive seeds, and they might travel. And those seeds can be detected in the airport. So you don't want the patient to get in trouble. So prepare for them a card with all the details of their treatment. Here, this is an example which type of cards we're going to giving to our patient name, passport, and the type of seeds and when it was inserted. And in case of emergency or extra details, they can call the number. We note down the on-call number. In summary, this is the things I just put small icons here for you to remember, because those pictures can help you in case if you want to remember everything I've talked about. The equipment, the personal training, the regulatory requirement, the quality assurance, and the radioactive seeds and delivery and safety as well, which I forgot to mention here, but I am sure you will remember that. General advices, which I also recommend, is to have a regular meeting to discuss the patient plans and improve the workflow, and communicating among all the team. And I would say that the communication is very, very important, especially in the OR room. You don't want to come the day of insertion and everybody doesn't know what they want to do. You should all talk like a harmony. Everybody should know what is they are going to do. Okay, we receive the patient. First of all, who is going to call the patient? Who is going to set the appointment for patient? You receive the patient. What is the first thing you want to do? Maybe you call the patient in advance. Who is going to call the patient to prepare? What type of food they want to do? And once you receive the patient the same day, patient should be informed what also extra instruction. He's going to go through anesthesia, what type of test they're going to do. And then you take the patient to the OR. And then maybe there is a nurse who will do the sign-in, and then you will give anesthesia to the patient, and then you will start. What are you going to do? You'll do the ultrasound, and then what? You will compare with the plan, and then you start insertion. So many things. This technique, you are involving all the members of different specialty in the same time, and you are doing that in the same. You want to do an insertion, treating the patient, and discharging the same day. So you don't want to get in trouble or stuck, or people are fighting, they don't know what to do, or they are lost. So communication is very, very important. So that's what I have today. Thank you so much. If you have any question, you can ask.